People with chronic kidney disease, CKD, are often believed to lose kidney function progressively, day by day, year after year. However, current science proves that this is not necessarily true. A significant number of CKD patients, despite being in the advanced stages of the disease, have stable or even improved kidney function over time. How do they achieve this? What makes these individuals different is their ability to treat the underlying causes of kidney disease naturally, without relying too heavily on medications. And don't worry, you can do the same. Thanks to my background in natural medicine and my experience, today I will share with you 5 ways to truly eliminate some of the most commonly prescribed and dangerous medications that CKD patients are often required to take. There are 5 types of supplements that actually work as natural remedies for the causes damaging your kidneys. We'll look at what's effective for proteinuria, diabetes, high blood pressure, and more. Many CKD patients go down the same path with kidney disease. When they are diagnosed with CKD, their doctors start prescribing them a long list of medications, but none of these medications actually protect the kidneys. These medications mainly control the symptoms and complications of CKD, with the idea that the patient will soon need dialysis. Let me know if this sounds familiar. Now it's time to break the cycle and look at which natural supplements can help us with proteinuria. Starting with what works for proteinuria, let's talk about how it can be treated with both medication and natural methods. Proteinuria is an extremely important marker for kidney health. It not only tells us how the kidneys are functioning right now, but it actually predicts how the kidneys will perform in the future. So always pay attention to your proteinuria levels, sometimes reported as albuminuria. What can you do to ensure that this level is under control? If you ask your doctor, there are a few options. First, there are ACE inhibitors and ARBs. You know, the common ACE inhibitors like lisinopril and enalapril, or ARBs like losartan and others. Most CKD patients use these medications for both proteinuria and blood pressure. Now, it's important to know that while these medications are certainly effective, they come with some side effects, the most serious being kidney damage that can occur over time. ACE inhibitors and ARBs are also why many CKD patients have high serum potassium levels. A newer way to treat proteinuria is with SGLT2 inhibitors, such as Farxiga. This method is also effective, but it's a very expensive drug, potentially costing up to $500 per month in some cases, and it carries a risk of urinary tract infections. How can you reduce proteinuria naturally? One effective method is using vitamin D. Vitamin D is the vitamin for the kidneys, and for good reason. It is very effective at combating proteinuria. Supplementing with this vitamin can lead to rapid improvement in proteinuria levels. In a recent randomized controlled trial, kidney disease patients who were given 2 micrograms of paracalcitol, a form of vitamin D, saw a significant reduction in proteinuria levels, 34% after a short period of time. Let me know if you'd like to refine or adjust anything. Now, the thing about vitamin D is that many essential processes in the human body will stop when this level is too low. Proteinuria will spike because the kidneys are damaged, and blood pressure will always be too high due to a lack of vitamin D, leading to the activation of the renin-angiotensin system, which causes damage to both the kidneys and cardiovascular system. The renin-angiotensin system is what ACE inhibitors and ARBs are trying to block, meaning if your vitamin D levels are low, these medications won't even be as effective as they should be. But why is this important? The main reason is that 8 out of 10 CKD, chronic kidney disease, patients have low levels of this vitamin. So, consider supplementing with vitamin D if you're serious about your kidney health. Next, let's talk about one of the most common causes of kidney damage, diabetes. When it comes to kidney health, there's no way to improve unless we address the cause of the damage, and it's no secret that nearly 1 in 2 people with CKD also have diabetes. If you have diabetes and your goal is to protect your kidneys naturally, managing your blood sugar levels should be your top priority. So, what are the most common medications people use for diabetes? First is metformin, a relatively safe and effective drug that's very helpful in improving insulin sensitivity. However, it still has some side effects. Metformin can accumulate in the blood of patients in the advanced stages of CKD. Another drug that's very helpful for diabetes is SGLT2 inhibitors, like Farxiga. This is particularly useful if you have both diabetes and proteinuria, but it's also very expensive, as we've seen. Now, folks, I'm not against medication, don't misunderstand me. I don't live with my head in the sand like some experts on the internet, and I would never say that all prescriptions are bad, because they're not. But you see, there are natural options that can give you even better results than these drugs, and without the side effects. So, what can you do to fight diabetes naturally? One thing I always recommend is apple cider vinegar, ACV. Unfiltered ACV is your best friend if you have diabetes. You see, with ACV, you just need to dilute 1 or 2 tablespoons in a cup of water and drink it before meals. Many studies show that consuming ACV can actually enhance insulin response and lower blood sugar levels, offering great benefits for kidney health, not just for those with diabetes. Now, another thing you'll want to add is cinnamon. Cinnamon is essential for diabetes because it's really effective and almost has no side effects, as long as you're eating or even supplementing with Ceylon cinnamon, not the cheaper cassia variety. Just a few teaspoons of cinnamon before meals is enough to see improvement. If we also add one of the most powerful natural supplements, berberine, we can really start talking about stopping medications. Just do this with the approval of your doctor, by the way. Berberine can have similar effects to metformin on glucose levels. But why would you want berberine instead of metformin? To avoid kidney damage, that's the key point here, right? As this study shows, the effects of berberine are equivalent to those of common lipid-lowering drugs, but with lower toxicity. Now, these supplements are great, but if your goal is to bring diabetes into remission, there's one more step you need to take when dealing with type 2 diabetes. The most important step is diet. Without a proper diet, you will always need more and more medications to manage symptoms, and the side effects from all those pills will multiply exponentially. Don't make this mistake because, as recent studies show, for people with type 2 diabetes, diet alone can be all that's needed to bring diabetes into remission. So, make sure 100% that your diet is working and that you're getting most of your calories from carbohydrates, not from protein, and especially not from meat. If you have kidney disease due to diabetes, limiting protein and calories is the way to go. You don't actually need to limit all carbohydrates with diabetes, just sugars and processed carbs with a high glycemic index. Now, since I just mentioned berberine, there's another issue that can be greatly improved with berberine, another very serious cause of kidney damage, but also heart disease, heart attacks, and strokes, cholesterol. It's well known that you should keep your cholesterol levels in check if your goal is to have healthy kidneys. What many people don't know is that if you have diabetes or kidney disease, your cholesterol levels should be lower than what the general population is typically recommended to have. This is especially important with diabetes. Some doctors are beginning to recommend keeping LDL, bad cholesterol, under 70 mg per deciliter rather than the 100 mg per deciliter recommended for the general population. This is not always achievable, especially because diabetes lowers your good cholesterol while raising your bad cholesterol. But this clearly shows us the importance of managing this health marker. Another issue with cholesterol is that to manage it, your doctor will often prescribe statins. Statins are a controversial drug. They work on cholesterol levels, but they also have some serious side effects. Statins can damage the kidneys by reducing both vitamin D and CoQ10, both of which are necessary for good kidney health. Statins are often the cause of muscle pain, which can worsen anemia, and they can make you feel fatigued and weak. So, you might live longer, but the quality of your life will be affected if you have to rely on statins. How can you naturally lower your bad cholesterol levels? The first thing I would look at is berberine. Berberine not only works for diabetes, it can reduce bad cholesterol by an average of about 25%, according to studies. Additionally, as we've seen, it has a positive impact on triglycerides and other markers. Another thing I recommend is phytosterols, also known as plant sterols and stanols. These are plant-derived compounds that naturally compete with and block cholesterol absorption in the gut during digestion. This forces the body to pull bad cholesterol out of the bloodstream, lowering your cholesterol levels, and it's really effective. Science tells us that taking 2 grams of phytosterols daily can lead to an 8% to 10% reduction in bad cholesterol levels. This research also shows that you only need to take this supplement for a few weeks to see results, which is great for protecting the kidneys. While you can achieve similar cholesterol reduction by taking statins, phytosterols don't have any of the unwanted side effects that statins do. Just like with diabetes, cholesterol must also be managed with diet. So, make sure you're focusing on following the right diet to control your cholesterol levels. A plant-based, vegetable-rich diet, with very little sugar and very little saturated fat, can make a big difference in controlling cholesterol levels. Now, perhaps the most important thing you'll want to naturally control to protect and improve your kidney health is blood pressure. If your goal is to improve kidney function, keeping your blood pressure under 130/80 is a must, there's no doubt about that. The kidneys have the job of keeping blood pressure under control in the body. When they start to fail, fluid starts to build up, and your blood pressure rises. That's why you might need 1 or more blood pressure medications. The shocking truth is that most blood pressure medications are very harsh on the kidneys. They can cause kidney damage. According to one of the largest articles ever published on improving kidney function with CKD, to achieve improvement, you need to keep your blood pressure in control. But this can be done without medication. The article, titled "Kidney Function Can Improve at Any Stage of Chronic Kidney Disease," shows that many trial subjects improved even at stage 5, before needing dialysis. So, you need to keep your blood pressure in check but not rely too heavily on medication. How do you keep your blood pressure under control without medication? First, focus on your diet. You know this, I know this, everyone knows this. You need to avoid consuming too much sodium, keep it low, under 1,500 milligrams per day, which is a very small amount of sodium, less than a teaspoon. Now, what most people get wrong about sodium is that they stop using table salt and think they're fine, but that's not the case. The issue here is that sodium primarily comes from processed foods, not your salt shaker. There are packaged products that contain nearly your entire daily sodium limit in one serving, so be very careful with any processed food you eat. This could change your life. Now, one supplement that very few people know about when it comes to blood pressure is magnesium. A large number of CKD patients are deficient in this essential mineral, and this can lead to high blood pressure. I especially recommend magnesium if you're also taking vitamin D or if you have diabetes. One more thing that I absolutely recommend for blood pressure is garlic. I'm bringing up garlic because it not only helps with blood pressure, garlic has been used by people with diabetes as a replacement for metformin. It has been used by people with high blood pressure to reduce systolic and diastolic blood pressure by an average of 8.3 over 5.5 millimeters of mercury, and it can also help with cholesterol, inflammation, the immune system, and more. If your goal is to eliminate medication and start improving your kidney health, you need garlic. What not everyone knows about garlic is that you need to prepare it in a special way for it to be effective, otherwise, it won't help at all. That's all for today. Thank you for watching, and God bless you all. Goodbye.